Let's talk about tips to keep your healthcare costs down. At the time of filming this video, inflation has skyrocketed, gas prices are at an all-time high, and prices for everything seem to be going up and up and up. When it comes to your healthcare, you don't have to sacrifice quality to get an affordable price. So in this video, I'm gonna show you how. Number one, avoid going to the ER unless it's a true emergency. So I'm not telling anybody don't go to the ER. If you need to go to the ER and it's an emergency, trust your intuition, trust your gut, and get to the ER. But if at all possible, there's any steps you can take before going to the ER, such as going to an urgent care, I would recommend taking those steps because hospitals are so expensive. So if you go into a hospital and they do the same kind of a treatment that they would do at an urgent care, you're gonna end up with a much bigger bill if you go to the hospital, especially the ER. But with urgent care centers, a lot of times the doctors in those centers, they're trained to handle a lot of like minor emergency type of care, and you'll end up with a much smaller bill if you go to an urgent care. Now with urgent cares, it's really important to know which urgent cares are in the network of whatever your plan covers, and also just know their hours of operation. So, for example, like if you live in a big city like Miami, there might be 24-hour, urgent cares. Pediatrician, there also are urgent cares for children and pediatrician types of things. In bigger cities, there's going to be just more hours. And if you live in a little bit more rural area, less populated, it's probably going to be a little bit tougher to find, to avoid the ER like you could in a big city because there's going to be less urgent cares. But I would definitely recommend doing that to save on your healthcare costs as far as emergencies. Number two, use GoodRx.com for all your prescription needs. So even if you have a health plan that has prescription coverage like mine does, I always use GoodRx. GoodRx has an app that you can download to your smartphone. I have that app saved in my little medical folder, and I go to that app anytime I get prescribed something, especially something new that I'm not familiar with. I always go on there and I look at what the cash prices are. So GoodRx actually, if you put in the name of a drug, it will list all the different pharmacies that carry it around you. Once you put in your zip code, it lists all the different pharmacies, and it actually tells you what the cash price is at each one of those pharmacies. And so you'd be really surprised, like sometimes a Walgreens and a CVS are across the street from each other and the price of the drug will vary by $20. So, that can be a big deal. And also GoodRx gives you coupons that sometimes make it even cheaper to just go through a GoodRx and not use your insurance plan. Number three is have a plan that utilizes telemedicine. So for example, my plan has unlimited MD Live, and MD Live is a telemedicine service. And my plan actually has one that is free. So I can go to see a primary care physician or kind of get urgent care treatment, also for pediatrician, for the most common things, like the kind of things that would normally happen to someone that's healthy, like a cold, a cough or congestion, even UTIs and things like that. I've even used it for an ear infection in the past. And so on my plan, it's free and unlimited. On some plans, there might be a small copay, but this really reduces your costs. And also you can kind of ladder up. So try the MD Live or try whatever telemedicine feature you have. Then, urgent care would be the next step up, and then the ER. So that way you can save on that. And if you can't and they can't treat you, they're just gonna send you up the ladder. So it doesn't hurt to try. Number four is for labs. So anytime you have to get lab services done. So you've got to get a blood test, especially if you go to your annual physical and the doctor wants to see, run the regular panel just to see how you're doing, how all your different levels are. That can get expensive if you do it in a facility like a hospital or even inside the doctor's office. If they do it in a doctor's office, just make sure that they send the lab specimen to be processed at like a LabCorp or a Quest. Or you can actually request to go to a LabCorp or a Quest, and that's all they do is they run these kinds of tests that doctors ordered, and a lot of times your insurance plan will give you a significant discount for going directly there. And number 5 is I would recommend that you use specialty imaging centers whenever you need an MRI or any kind of imaging or things like mammograms. And the reason for that is because these centers that specialize just in that, like for example, when I used to go get a mammogram in Miami, I went to this place that was for women only, and all they did was mammograms, uterine ultrasounds, things like that that were just tailored to women. So the people that would work there really were become kind of specialized in that area, and also the pricing is a lot friendlier. So it tends to be a lot cheaper than if you did it at a hospital. So if you have questions about anything related to reducing your healthcare costs, or if you have tips for me, please share them in the comments and connect with me. I'd love to support you and be a resource for all your health insurance needs. You can connect with me at alexthehealthagent.com and also on Instagram at alexthehealthagent.